But in addition to thinking about the breast cancer screening mammograms in average risk women, the other important thing is how do we identify women who may be at higher risk of breast cancer? Because maybe then we should be doing additional or extra screening for them. And the concept here is shown in this diagram, where if we take the whole population of women and we are able to identify women who are high risk, medium risk, or low risk, we could then group them into different groups. And by grouping them, we could then tailor our screening in order to meet that level of risk. So maybe in the higher risk women, we think about intensifying the screening or adding maybe potential ways to prevent breast cancer with surgery or other means. And in those who maybe are at lowest risk, maybe we can de-intensify or reduce the intensity of screening. And so this would be an important concept as we think about what's called risk assessment. So how do we do this? What are some of the risk factors that determine an individual's cancer risk, and in this case, breast cancer? One of the clearest indications of cancer risk is identifying a germline mutation in a individual with with a higher risk for breast cancer. And I'll come back to this in a moment. But the family history is also an important indicator of our risk of cancer, and in particular in breast cancer. But there are other personal and environmental factors, hormone exposures, radiation exposures, other factors in our environment. There are also factors that we're unable to explain, and that's what's termed here the stochastic factors that will never be able to really determine what all of the risks of cancer are that determine the development of cancer.